This week is an incredibly busy week for me. I am teaching on the Neonatal Life Support course later on this week, and I'm quite looking forward to it, but I'm having to brush up my knowledge because there's been an update in the NLS guidelines nationally. And it's just given me the opportunity to go back and look at when I started teaching neonatal life support as a GIC instructor and try and make the comparisons so that I know exactly what those updates are. And I'll give you a few statistics. I'll give you a few statistics around resuscitation because that's one of the things that has changed actually. We don't really sort of the statistics of how many babies would breathe, how many would need assistance, all the rest of that, whereas actually this has provided that, which is amazing. But also the focus around delayed cord clamping has become much more obvious as the reiterations and the new additions have come out over time. And it's something that has been taught for quite some time now to, where possible, leave that cord intact. If you've got the ability to be able to resuscitate with the cord intact, try and do that where it's possible, especially for preterm babies. And that's one of the biggest things that has changed over time, is that we are now more actively encouraging where it is safe to do so, where there's the facilities, the access, the resources, bedside trolleys, things like that. I know not all units have got it, but the ability where possible to leave that cord intact, because it also helps with the oxygenation and that transition to going from inside to outside. And here's just some of my colour-coded bits. So with preterm babies, it's more about stabilisation. These babies often don't need sort of full resuscitation as such, because it's not that the baby's been deoxygenated, it's just that the baby is a lot more small and developmentally they just haven't adapted. So it's changing it more to stabilisation, that breathing support that's required postnatally. And in relation to statistics, only about 1 in 2,000 births will move on to full chest compressions. For most babies, we've always known that it is almost always an airway aspect and something that we just need to do from a respiratory support perspective. But only 1 in 2,000 births will move on to cardiac compressions, highlighting that cardiac compressions for CPR on a baby is incredibly rare. About 85% of all babies will initiate spontaneous breathing between 10 and 30 seconds at term, so over 37 weeks. 10% will then actually respond during drying, which is why we give them a nice little rub after birth to try and stimulate that response in them. And then only around about 9.5% of babies at term will take over a minute to really establish that breathing. And what I love is there has always been a section on physiology, but it really includes delayed cord clamping now, which is just fantastic, highlighting that things are moving on for the better. The full NLS course is something that I highly recommend to all midwives to be able to do. It is essential when you are a community midwife going out and attending home births to have those skill sets. It's one of the most multi-professional days I've ever attended, because you have your paediatricians, you have your paramedics, you have nurses, you have midwives, you have so many different healthcare professionals who attend this course. And it's a fantastic opportunity to really learn, both for learning about out-of-hospital births, but also in-hospital births too. It's a challenging course, but it's one of the things that's changed, because when I first qualified, it wasn't really a requisite for anybody. Then it started coming in for sort of your more senior band 7 midwives, and then it also came in for your community midwives as well, who were attending at-home births. And then eventually it suddenly becomes something that is more of a choice. We all have an update every year of, around about sort of 45 minutes to an hour on prompt multidisciplinary days in our trusts. But to do the full NLS course is just fantastic. And I know I'm biased because I'm a GIC instructor, but it is one of the best courses that you can attend for your confidence, for your skills, and so that we help improve that safety and those outcomes in responding, recognising and managing neonatal resuscitation when it's required in the rarest of circumstances.